Today we welcome Shannon Brinker to our broadcast here at Dental Products Report. Shannon is a regular contributor to our publication and a noted speaker and expert, especially on the dental assisting community. And Shannon, thank you so much for joining us today.
Well, thank you for having me.
Mm-hmm.
Really appreciate it. Very excited to share some knowledge with you today.
Yeah, well, and to kind of get started, Shannon, the last couple months have got to have been very different for you. Normally, I know you're on the road a lot of the time. You are speaking to live audiences and interacting with people in the dental community around the globe. So what has this last stretch of time been like for you personally and professionally?
Yes, it has been. It's been really tough because I will say that, all of my courses, I think all the way up to the greater New York have been canceled, which stinks, but I get it, and I think one of the things we had to do was back up a little bit and still be able to not only be there for assistants and listen to them, I think was probably the best thing we could do right now, is just having a sounding ear for them to talk to. And then the other thing is now was the time for us to really bring that education, because for those that needed it, they've got a lot of time on their hands. And so I think it's the perfect time for them to reinvent themselves and, most importantly, gain more knowledge of where they maybe didn't have before.
Mm-hmm. Now, with the dental assistants, most of them were idled during the last month or so as practices shut down. I know, talking with a lot of dentists that I've spoken with, a few did keep one assistant on to help them with the emergency cases they were treating. But what have you been hearing from the dental assistant community throughout the first month or two of this pandemic?
Yeah, I think it's been a mix. It's been a very big mix. There's so many dental assistants that have reached out to me as far as, what do we do? How do I know that what we're going to be changing in the practice is going to be very effective? Because, of course, a lot of dental assistants are female and worried about their kids, worried about their families, and then the other thing is they're worried about their jobs and they're worried about just being the doctor. And that kind of makes me sad, because it makes me sad and it makes me feel good to know that these assistants are out there, feel connected to their dentist. And again, we're sitting knee to knee with them all day long. But I also feel for them, because what I'm hearing is there's no real plan. And that's what I would say encourage dentists right this minute who are not back in the practice or maybe not seeing emergencies is stay with your team right now, because one of the things that you don't want to do is not stay connected with them, right? Checking in. I mean, it's just like having patients, checking in with your team, letting them know how things are going, and most importantly, making them feel safe. And I think that is where a lot of practices are lacking right now. And then again, not the unknown of what do I wear? How do I protect myself? How do I know what we're doing is the right thing? And so I think just having that formula, I would say, but most importantly, these doctors have got to reach out to their team and keep them abreast of what's going on.
Mm-hmm. Now, you mentioned safety. I imagine that is one of the bigger kind of concerns, issues on the minds of all dental professionals as they get ready to return to work in about half the country this week, or things are starting to open up. And do you hear, are people feeling comfortable with the equipment or protocols they're being provided with, or where are assistants falling on the changes that practices are trying to make right now?
Well, I think one of the things that we're seeing, Noah, is the lack of supplies, the lack of the personal protective equipment, which I know everybody is feeling. And then just knowing what are the parameters. Even yesterday in our chat room that we have for assistants, that was one of the number one things is, what are the protocols? Are they supposed to change the gown after every single patient? Do they leave the personal protective in the room? And then, thinking about the supplies and the masks that are available. And most assistants have never worn shields before. So it's going to take some getting used to. And because most hygienists will wear the shields and we don't, and just being honest. So it's going to be again, getting used to, but I think also not having the proper protocols and the step-by-step of what we have to do, and laying that out, according to CDC, but most importantly, the ADA recommendations, and just having a system of what do we do, and how can we minimize, not only minimize any cross-contamination, but trying to do the most procedures that we can. I think going back in that one appointment is really something that we all need to be thinking about, because if we can do restorative, if the patient needs restorative and have the hygiene appointment all be at one time, then we're minimizing that cross. And I think that's one of the things we're not thinking about is how much can we do in that one appointment that the patient may need versus, moving them around, and just having a system.
Mm-hmm. Now, I know that in a lot of practices, assistants have a role in purchasing supplies and equipment for the practice. They're involved very intimately in the organization of the practice and basically making sure everything that's supposed to happen happens. Are you hearing from assistants who are out there struggling to purchase PPE, and kind of what are they dealing with? And, is there a light they're seeing at the end of the tunnel right now?
It's kind of we're very loyal people. And when we think about our Shine, our Patterson, Binco, Midway, all these companies that we work with, but the problem is we used to be dedicated to one. Most people practices are, because of the perks of being dedicated to one. It totally is not the case right now. We're scrambling to try to find masks in one location, gowns in another, all of those things. But one of the things that we're really trying to encourage practices is to place orders now, because it's taking, I ordered a shield for me, and it took me about 5 weeks to get that from Shine. So it's really important for you to look at your supplies. And I will tell you that right now I'm working with 3 practices on what do we need and what is the protocol for going back. Also, how now more than ever, we got to be organized and have systems with our supplies. And so those 3 practices are actually this whole week cleaning out all the supplies and getting everything ready, thinking about the trays, having the more than ever the protocols that, the CDC guidelines that we should have already had. They really got to enforce it now, for some of those practices that were relaxing that. So now's the time to get your supplies in order, making sure that you're in compliant, and second of all, get those things ordered that you need for that personal protective for your team.
Mm-hmm. Now, well, most of the requirements that we're hearing coming from the CDC and OSHA and other groups are essentially taking processes and workflows that already existed and should have been being followed anyway, and in some cases stepping them up a little bit in terms of what type of gear to use. But should this be stuff that dental professionals already know, and it's really a matter of just getting back to your basics and adhering to it?
Oh, no, and no. It is a huge transition. I can't really speak as much for the hygiene side, but we knew already that only 6% of the practices place rubber dam. So now I'm doing rubber dam webinars on how to place it, because most assistants don't know, and most practices didn't do that. We're thinking about, the aerosol and having, the clean air filters, most importantly, having uniforms, not just disposable, but, even though they say nothing will get through those gowns, we beg to differ, right? So we're looking at a uniform line, even one right now, that is from actually an assistant that I know. He has designed these 2-ply dental scrubs, and they're basically on a website called mydentalscrubs.com. And not to shoot that out there's a lot of scrubs out there, but there's a lot of things about certain uniforms. This one is a 2-ply. We're trying to think about what can we do to keep, even if we're wearing disposable gowns, keep our body covered, and then just knowing mask. And I have to tell you really quickly that I ordered some masks that I thought were N95 masks on eBay, because one of my assistants in my chat room said, hey, you can get these on eBay. And I got to be honest with you, they're sitting in my living room for me to send back. They were not the mask. And so, I was kind of fooled by that. And I think that's where we really have to be alarmed. And then all of a sudden I see this thing where, hey, be careful with people trying to take advantage of us right now, because they know how desperate we are, especially in the dental industry. So really making sure, it's one thing to wait 4 or 5 weeks for materials, but make sure you have a reliable resource of ordering those because everybody's trying to make a buck right now. And the last thing you want to do is do like I did. I spent $300 on, I think it was 15 masks, and they are knockoffs, right? So just being really careful with that and making sure that we're all protecting ourselves, not just the gowns, right? And again, listening to the CDC guidelines and making a list of everything you should be doing, so everybody's on the same page.
Mm-hmm. Now, you mentioned not having used a mask in practice before, no, not a mask, a face shield in practice before, and that's something to get used to. Do dental professionals need to take some time to quite literally practice putting on and taking off their gear and just getting used to how it feels to move and do the things they do in it?
Oh yeah, a friend of mine, Jason Lipscomb, he had talked about going back on Monday. He's from this area, from Virginia, and he was talking about seeing an emergency patient and, putting everything on. He said, "Oh my God, I thought I was dying. It was so hot and sweaty." And wearing a N95 mask. And then right now they're telling us to put on a level 3 mask on top of that, plus having the shield, plus having the loops, plus having the gown and the uniforms underneath. He was like, "Oh my God, it was like 100 degrees, So I think that is something, and then not be able to have a fan because you don't want the aerosols going anywhere. And he said, I had to add like another 20 to 30 minutes. And I think that's such an issue, is making sure that you're not only talking to your assistants and your hygienists, but most importantly, talking about your team up front when it comes to that schedule. You really need to add like 30 minutes. So where we were used to cramming people in, you can't do that anymore. You really got to step back and make plans. And again, if you're not, we know right now, like here in Virginia, we can only see emergencies. It's the time to really be meeting with your team, and just getting on like a Zoom meeting, just like we're doing now, and just really talking to your team about what is the plan, and how much time we need to maybe reach out to our patients and say, "Hey, listen, this is the plan too of protocols," but extending that time, because oh my gosh, I could imagine. I feel exactly for them, but I appreciate the fact of those doctors that are already back at work, just kind of filling us in on what it's like right now. Is a huge eye opener.
Yeah, and I'm hearing similar things. I spoke with our chief clinical editor, Dr. John Fluke, about getting ready to reopen his practice, and he shared a very similar story about just how hot it's been working in all of the new gear. And it seems to me like there's going to be room for innovation in the dental space going forward, because people are going to need better equipment that still gets the job done safely, so that we can continue to protect our patients and our professionals here who are helping all these patients. What types of things do you think, we're going to need to do to adjust and get this to a new normal so that everyone is comfortable in the practice?
I think, first of all, reevaluate the chemicals that you're using. First of all, again, following the guidelines, making sure that the chemicals that you're using are up to standard. We really don't sometimes, we know, Noah, in dentistry, we don't read, right? I mean, that is something we're not used to doing. We always think we can just come up with our own directions. This is a time you cannot do that. You've got to read the back of the label of what you already have. And if that is not a wipe that you can use, or, that's not, you're mixing things with part water, now's the time to not even be thinking about that. Looking at the chemicals and reevaluating that is number one. I think also looking at, what are you ordering, and is that in compliant? I mean, everything that I keep going back to, even with the assistants that are asking me, is go by the CDC guidelines, keep up with the ADA website, every couple of days, because they're constantly updating it. But I did have a great call, I'll be honest, about 2 weeks ago with 3M, and just listening to what they're doing and really trying to jump in 100% and really start, really fastly working on, the gowns and the uniforms and the all the materials that they probably didn't spend as much time on before. It's totally changed now for a lot of companies. And like even with Cranberry, I know they just developed a rubber dam, and I've been working with them like a year, because I do love rubber dam placement. And they're really working on, just really trying to teach assistants how to do that, but most importantly, trying to teach them pretty fast. And just really looking, I say, reevaluating your supplies. It's so important right now. If we know we hopefully may go back, in a few weeks, some have already back, spend the time to look through your supplies, and most importantly, reading the directions and looking at what is in those chemicals. And I can't say that enough, because there's so many things that we were using before that didn't kill as many many infectious diseases that we thought. So, now's the time to reevaluate those chemicals. That's the number one thing we have to do.
Hmm. In terms of, you've been doing a lot of CE programs for the dental assisting community lately. What types of classes are the assistants using their time when their practices aren't opening to take? And kind of, are there things you think that they should be studying up on more right now?
Yes. I mean, well, first, infection control is number one. The downside to that is everybody and their brother is the expert, right? And that worries me, because there's so many that, so many people are taking, this and that and this and that on infection control. And again, you're only good as the person that's training you. So I keep saying, listen, I almost try to stay away a little bit from the infection control, because I keep saying, go back on the ADA and paying attention to that, because again, everybody is the expert right now. And so that does worry me. The other thing is that I feel like if you think about the number one things is, how can we minimize the appointment, or if it's only one procedure, or looking at it from a totally different standpoint, how can we maximize it? Maximize it as much as we can with that patient and their needs, because I think, we had a lot of patients before that would say no to treatment, but now we want to look at, how can we maximize that appointment? And then the other thing that we're hearing is, especially for pedo and ortho, when they're used to open bays, is one of the things that we are kind of putting together for another ortho office is skipping every other chair. Because what they're doing, when my kid goes back, moms usually want to go back, right? And it's trying to get parents to understand that we're trying to have a safe environment. And the last thing we want is for families to be back on an open bay and then, looking at the kid that's one chair over. So I will tell you, I think the people that have it worst are pedodontists and orthodontists, so really looking and reevaluating that right now is a big, big deal. And, but I will say that the number one is, how can we do isolation? What devices are we using? And again, we hear so much about the hygienists right now and the aerosols. But I think Dr. Fisher from Ultradent probably said it best. We're not thinking about the assistant. I mean, our face has always been in front of the handpiece, even more than the doctor, depending on where your doctor sits. So I think ergonomics is really important. That was probably number one webinars that we gave, is sitting appropriately and forcing your doctor to sit where they need to sit, because we got to look at the spray. We got to look at, the aerosols as an assistant, I think probably more than anybody in the practice. And we're usually the ones that are almost forgotten about, right? So I think the suction devices, the isolation devices, and that rubber dam, going back to that rubber dam, is really, really important right now. And choosing the HVE versus the Slava ejector to suck out all the aerosols. Again, just reevaluating everything when it comes to the procedures.
Do the assistants that you're in touch with feel that if things are done the way that the CDC is recommending, we're using rubber dams, we're using masks and face shields, and we've got proper evacuation going, do they feel that regular dentistry can be done safely in this time, or are people still feeling concerned?
There's concerned. I mean, there's a lot of areas, Noah. I mean, that I wish I could share them all, but I will tell you that I was looking at, I did a poll because I wanted to just kind of know where these dental assistants are coming from. And really some of it does kind of make me sad and scared, because, there are practices right now that, assistants that are on unemployment, which is most of us, are really getting paid more on unemployment than we got in the practice. So we have some assistants that are saying, well, why would I go back? I'm making more right now, and I know that's going to end, but I think that's one of the things we're seeing. And it's like, oh my gosh, you got to talk to your doctor, right? Because doctors cannot work without assistants. So we got to reevaluate. I think before, when we look at where assistants were on the, I hate to use the word totem pole, but I'm really trying to be honest with the dentists out there, is, the assistants were on the bottom of that. And now we're finding ourselves reaching up there to the top, because even though we've all been out, I think the most important patients are not patients that are coming in for hygiene. They're the ones that's coming in for restorative. And so, these assistants are scared, but, the way I think to overcome it is have a plan and to sit down with them or call them and say, listen, let's put a protocol together of how these patients are going to come in. We want to make you safe as we possibly can right now. And I think then those assistants will feel better about the protocol. It's where we're looking at the level 1 mask and the doctor's not investing in the right materials and the right way to keep us safe, is where these assistants are saying, I'm not even going back. And I'm like, oh my gosh, practices can't function without an assistant. So for those doctors that may be worried that their assistants are not coming back, I think it's time to really put that protocol in place to keep your assistants, because the last thing you want right now is to be without one, and so there's a lot of assistants that gave me a lot of information, and don't really know what to do, but now I think more than ever, we have to be worthy of those assistants. We have to be worthy of the skills that we have, and again, having a different feeling sometimes than what we had before, and really appreciating the assistants that are working with you to keep them coming back, and to want them to be back in the practice, because we can do without hygiene, but we can't do without restorative right now. So that was my only advice. That's what I would say.
Mm-hmm. In terms of, the patient experience, obviously patients are going to be dealing with a very different look and feel when they come into a dental practice. Are there things that, the assistants can do to help these patients feel more at ease and feel like they're not only going to be getting the top tier dental care that they expect, but they're going to be getting it in as safe a way as possible during these times?
Yes, I took a webinar on Friday from a group, My Social Practice. It was probably one of the best webinars, I will say, that I hate to throw out names, but I got to be honest, it was one of the best webinars I'd ever taken. And one of the things that they talked about was how to be close with your patients, but keeping them engaged and letting them know that they're safe. And one of their ideas was, which I thought was great, is constantly doing videos about your practice and how you're going to make them feel safe. And most importantly, setting the protocols again, letting the patients know that this is what we're going to do. We're going to, when you come to the office, we're going to be texting you, to come in. We'll let you know when it's the right time when they come in. We used to be that lovey huggy, touchy feely, which is, I'm that way. It's going to be so hard. But having the protocols, Mom, you're not going to do a touch screen anymore. We're going to, cover our pencils, have, sign in with me. I'm going to hold it and we're going to sign you in and we're going to check you in through the glass. The other thing is, a lot of consultants don't like that glass. So a lot of practices took that down because it felt like it was a barrier between the team up front and the patient, right? And I can't tell you how many people I've seen put that back up. Most importantly, having them, take their temperature and, washing their hands or, using sanitizer. But I think if we just let patients know, that was one of the things that I took away, is that we're not doing enough of the social media, which is now the time more than ever to let your patients, and these doctors that he was showing were so sincere, and the team too, that I was like, gosh, that's such a good idea. And then again, going back to the protocol, putting together the best protocol you can. And there's so many people out there that are doing it right, that, I kind of, I hate to say, steal from a lot of different ideas and people, but it was one of the best webinars because we're saying, this is the way to still feel good with the patient, still feel close to the patient, but getting rid of magazines, getting rid of anything, that could be out in the waiting room that could cause, an eye to open, or cause a concern with patients. So all the things that we used to do, and having the pictures of our family and having things like that and having food and bottled water, we got to take all that away, but letting the patient understand why. I think was such a good eye opener from that webinar. And that was one of the things I took away.
Mm-hmm. Well, wonderful. Well, Shannon, is there any sort of, final thoughts you have in terms of what's been going on with you and what's been happening with the dental assistant community right now?
I think, just letting the assistant know now more than ever, if you never did, and I'm going to talk to doctors right now, is let them know how much they mean to you, because, even though sometimes there's a lot of dentists that will appreciate and share that. And a thank you goes so far. It's not about the money for us, because we know in dentistry, we're never going to be rich, right? But just letting us know, hey, now's the time for you as a doctor to say how much they mean to you, because I think that was probably the biggest eye opener, as we've been away from these patients. And, we're used to, being with those people, and again, almost like a, coming to be fulfilled ourselves, not just us fulfill patients' lives, but don't forget about your team, and now's the time where we need a family more than ever. And I would say, to those doctors that maybe weren't that way before, and we all have different personalities, now's the time to put those personalities aside and let your team know how much they mean to you. Because again, without the team, we're nothing, right? And that would be the most important thing. And I think listening to me on those checklists, what supplies you need. And maybe this week, if you're not in the office seeing patients, maybe back up a little bit and go in and assess what you need and what you need to order now before, because last thing you can't go back to work if you don't have the proper equipment. So I would say that's one of the most important things. And if I can help you in any way, I always think that's so important. But again, letting everyone know, and then most importantly, assistance, thanking your doctor, because I don't think anybody wants to be on employment forever, right? And it will run out. So you need to have, feel safe, but most importantly, getting back to that relationship with our team is probably the most important things I would say I can leave you with.
Oh, wonderful. Well, Shannon, thank you so much for joining us today. We look forward to continuing to work with you and chat with you about what's going on in the dental assisting community and the dentistry industry at large. So thank you
Well,
once again.
I want to say on behalf of the assistants out there, thank you so much for even having this today and to have a way for us, because we haven't seen it, and I have to thank you and thank Dental Products Report for even thinking about us. It means a lot. And so I think that's one of the things I can say is you're trying to build that whole community back together. So thank you so much for doing this. I mean it.